Following the submission of a petition which exceeded 3,000 signatures in respect of the subject matters of the potential closure of Claremont House Care Home, a petition debate shall now take place. Can I invite the representative of the organiser of the petition, Donna Mallinson, to make a representation to the meeting for a maximum of 5 minutes, and then the Council may debate the petition for a maximum of 15 minutes. And we have an understanding that there will be one speaker for each group for 3.5 minutes approximately.
Good afternoon, councillors. We have presented our petition in opposition to the proposed closure of Claremont House Specialist Dementia Care Home in Hetmond-Wyke. This petition has 4,713 signatures, which indicates just how strongly we all oppose the closure of this wonderful care home. Putting it simply, it is the home of our family members and loved ones. A home is where you feel loved and happy and safe, and this is the first time our mum has felt this way since she began her journey with dementia. Every single one of the residents are cared for and loved as they should be, and are living out their final years in a loving and happy and stable environment. And we families all have the peace of mind that this is exactly the case. Kirklees' proposal to close this home is flawed, has inaccuracies, and fails to report on the reality of what will happen to these vulnerable and poorly residents if they choose to close the home and force them to live somewhere else. The residents' only option, should they be evicted through no fault of their own, would be to go to private sector care. Kirklees have provided the names of 6 private sector care homes that aesthetically are comparable to Claremont House. For example, they have ensuite rooms and a garden, but this is not thorough research and fails to provide information on the quality of care or the cost, which are very important factors for consideration. Historically, we and many other families have first-hand experience of private sector care and can vouch for the maltreatment of our family members, the mysterious unwitnessed falls, the medication given to calm them down, and the lack of personal care, the missed meals, and I could go on. And we have done more thorough research into these 6 homes, and we can confirm that they are not comparable care-wise or cost-wise to Claremont House. And these 6 homes, the weekly cost for a self-funding resident would be between £250 and £472 more expensive per week. For local authority funded residents, they would require an additional third-party top-up of at least £100 per week from a family member. How can Kirklees force self-funding residents to have to pay more and even get inferior care? And how can they expect a family member to have to find that amount of money again for inferior care? In fact, only one of these 6 homes claims it can care for residents with advanced dementia. The other 5 don't, and I've said depending on what behaviours present, the resident would probably need to move again. Claremont House is one big extended family. Every single resident is treated differently because every single resident is different. They are not a tick box or a chart or a list, and every single member of staff at Claremont knows this and respects this. And we family members know this and don't worry when we're not there. Families know each other, and visiting families interact with every resident, and all faces are familiar to everyone. Residents are actively encouraged and helped to interact and have the freedom to be with who they choose to be with. Private sector care does not give this. In fact, as part of our research, we have been told recently some of the things that really happen are, yes, we medicate residents for their own safety. Doors are kept locked because not all residents get on with each other. And helping residents with feeding or dealing with those who are doubly incontinent is too time-consuming. The reason Kirklees is proposing to close Claremont House is because they say they can't afford to keep it open. So in reality, what they are saying is that these residents who have paid their taxes all their lives are too expensive to look after. But how would the people making this decision feel if they were in our position now and know what private sector means and absolutely dread the thought of their loved ones being forced to live in it? Not only is the proposal flawed, the proposal is morally wrong and inhumane. Kirklees have said numerous times that they want to find out what good care looks like. And we keep on repeating ourselves by saying Claremont House is exactly what good care looks like. It is the perfect example of how a care home should be run, and the staff are a perfect example of how anyone working in this environment should be. It makes no sense at all to close it down, then move everyone to an inferior model which is not fit for purpose and will drastically shorten or even end the lives of our loved ones. And closure just won't affect people's lives now. It will affect advanced dementia sufferers in the future, and I mean the very near future. Every one of us here today could be a future sufferer, and if you are, where would you want to call home? We know exactly where we would want our home to be, and it isn't in private sector care. There is absolutely no way this closure can be justified. Thank you.
Thank you, Donna. Can I ask Councillor Ramsey to respond?
Thank you, Donna. I know how difficult it is for you. And thank you for presenting on behalf of everybody who signed the petition. I know I've said it before and it doesn't make it any less true. I'm genuinely sorry that you and the other family members are having to go through this stressful process. I understand how hard it is for you as well in preventing that stress that you're feeling being passed on to your loved ones. As families, you are rightly concerned about the implications for your family members. As a Cabinet member, I'm not only concerned about that, I'm also trying to balance that with the social care outcomes for everybody in Kirklees, and also of the other services that we've got that the council needs to deliver for our residents. The reality is that there are some areas of provision where the council needs to play a greater role, and other areas where there are already organisations providing that sort of care. And given all the pressures that the social care at the moment and in the council as a whole, not just financial, the council needs to focus on the areas where we have the greatest need. As the residential care sector has stabilised and recovered following the pandemic, pressures on the social care have grown. Long-term residential care is an area that the council feels it should not be focusing time and money on at this time, and instead using some of that time and money in areas where the council will have a clearer role. That's what the consultation is about. Whilst this isn't just about money, the reality is that there's significant sums of money that the council are spending providing care itself is money that the council cannot then spend on other people who need social care or other services in the council. I just want to address a couple of things that you have raised. I didn't see what you were going to say before, so from the point of view of private sector quality, we are assured that there is good quality private sector beds available. And I think there's some didn't want to start any individual conversations during the consultation, as your focus rightly has been 100% on making the argument to keep the homes open. So we haven't been able to prove this to you. I know you say you've done your own research, but if and only if the decision is made to close, we will do exactly what we promised, which is make available some dedicated resource who will work with individual families and residents to look at all the relevant issues for your case, for your loved one. The care surroundings, the geography, the look, the feel of the home, the approach, cost, whether there are some residents that want to be transferred together, etc. We also really value the relationship we have with the Carers Association, Kirklees Carers Association, who again we haven't been able to introduce to you, but are incredibly knowledgeable and will provide a lot of detail to the homes that you assist to. Don't know how I'm doing for cat time.
Yeah, you're well over.
All right, okay. So thank you again, Donna.
Am I allowed to say no or not?
No, we're going to have members respond.
Okay.
first. Councillor Hall.
Thank you, Mr Mayor. Can I add my thanks as well for you to come in to address us and to acknowledge the passion with which you hold these arguments, because this really is not like any of the other decisions which the council is making at the moment, such as with a sports centre or something like that, even though those are important things, because we're dealing with people's homes and we're dealing with vulnerable people. Some of the most vulnerable people in our society. So this has to be treated with a great deal of care and compassion at all stages. I just think we ought to recognise that we shouldn't really have had to come to where we are at the moment. And I do feel that successive administrations have taken their eye off the ball as far as the running of some of these facilities are concerned, because we have care homes which are quite far under capacity and they're very expensive to run. And the council has had a long time to look at that model to try and transform it into something where the care is good, but it's not as expensive to run. I think there is a way forward for this. I'm convinced that the council, talking to the private sector and listening to the arguments that have made, can come up with something which will involve no transfer of the residents from Claremont, because it's important, of course, we've all heard, that they are treated by the people that they know and the people that they love, and that they aren't moved from the surroundings they're in. I'm sure there is a deal to be done there, and maybe that would involve some level of continued funding on a lesser level at the moment over a shorter period of time. So, can I say thank you again for coming. I mean, it's a shame really that the council hasn't taken the steps before now to try and get this sorted, really, because I think to put the families and the residents of the homes under all this pressure might have been avoided if the work had have done a little bit sooner. Thank you, Mr Mayor.
Thank you, Councillor Hall. Councillor Davis.
Thank you. And I'll just add my own thanks and my own appreciation of what you shared with us today. I'm going to take this at a slightly personal level at the moment, because it is personal to me. I'm not going to get emotional, but my own mother is in a care home in Kirklees with quite advanced dementia. So I understand where you are with this. I just want to express that. And it isn't just about the individual residents who's getting used to a new place. I've seen my mum go through this. Every time a resident is moved from one place to another, it isn't about them getting used to new faces and a new location. That step change in routine and taking residents away from their familiar face, their familiar situations, leads to a massive deterioration in their dementia. It takes that person further away from their people, from their families, and they'd never come back from that. However sensitively you look at relocating somebody, however lovely the private care home is. My mum's in a private care home. They're not all dreadful. I can talk to you about that. But they never come back from that. It's a step change in deterioration. People never come back to where they were before. You're taking these family members further away from their loved ones, not just geographically, but emotionally and in that personal thing. In the wider impact, you mentioned about the wider social impact and the wider benefits of the community by saving money in one place to spend elsewhere. There's already anxiety out there in the community about dementia care, the lack of places, the lack of daycare facilities. I know people who are looking after people in their own homes who don't have the access to funding. They're looking at this story here and they're frightened for their own family members and what's going to happen to them going forward. So with that all said, before I break down myself, I'm just going to urge that we actually review this fully and properly and keep these people in their homes. Thank you.
Thank you, Councillor Davies. Councillor Cooper.
Your deputation and for the petition and a lot of the issues that you've raised are exactly the same issues that are being faced by the families of residents at Castle Grange in Newsham. And I've attended the consultation session, or one of the consultation sessions with them, and all the passion all the concern, all the heartache that's going on for you is going on for them as well. It's the same issues, and so you and they are living every day this, and so I feel for you, and I understand exactly what you're going through, what families have got to go through to do this. And I think nobody would disagree that the council is facing some absolutely awful financial choices. That's just a plain fact, and it's been placed in this position because of the way local government is financed. It's a complete mess. But what it does do when you're in a situation like this, it says, well, what's important? What are the things that the council is about? What are the things that matter the most, really? And looking after vulnerable people, looking after people who are who's suffering the most is probably one of the jobs that we've got to do, one of the reasons that we exist in the first place. We've got to ask ourselves what we're about. And there's real concern from yourselves, and you've really looked into this in a big way, and I think there's got to be a big dialogue with the council, feeling that there are not the same quality of care in the private sector than you're experiencing in the public sector. And that should be a matter of pride for this council, that people look at the care that people receive from the council and say, this is the best in class. This is the best. It's something we should be celebrating, not something that we should be cutting. And to actually say, well, actually, we're paying too much. We're probably paying the right price, and everybody else isn't. That's the sad choice here. The quality of care at both Claremont House and Castle Grange is excellent. And the feedback you get about the work that's going on there people trust the council. People trust what we do. And that is something that we should value and we should treasure and put the money into to make sure that it happens. One of the questions was, Kirklees has got to look around and see what good care looks like. Look in the mirror. Look in the mirror. That's what good care looks like. Look at Castle Grange. Look at Claremont House. Those are the places where excellent service is going. Helen Plaskett from Claremont House came to this council and said, find another way. Find another way. And now I know that is an easy thing to say, and I know that the council is finding difficult choices. But it's a cabinet system, and I've got to say, I support what you're doing, and we should try and find another way. Thank you.
Thank you, Councillor Cooper. Donna, I will allow you, if you wish, to respond to some of the remarks, if you could do that briefly.
Yeah, sorry, just quickly, Jackie, when you were speaking, one of the points I made was about cost and how much more money it will cost the residents of Claremont if they're moved, whether they're local authority funded or private or self-funding. This is a huge worry for families who perhaps have, if they're self-funding, they've budgeted their loved ones' money, so that money now is not going to last as long. For local authority funded families, they are in a position where they have got to find at least £100 per week extra. How can you justify that? How can that be morally right to do? And what, and sorry, this question has briefly been answered in a Q&A that we've received by email, and it said that social workers would be advocates between the residents and the homes regarding the top-up fee, but that is just words, that's not promising anything. And it said in cases where an agreement cannot be made, the resident would have to find a place that is not, that doesn't require a top-up. So there are so many grey areas that are causing families so much worry, and this is going to go on for months now. So the difference in cost is massive for us.
Thank you. What I would ask is that if Councillor Ramsey would, if she could respond with you directly, okay. Meet with you or respond. Will that be okay, Councillor Ramsey? Yeah?
Okay.
Okay, thank you.
Right, thank you.
Thank you.
Thank you.